Surgical technology is part of a larger health sector called allied health professions. This family of professionals includes medical technologists, nuclear medicine technologists, bioengineers, respiratory therapists, laboratory technologists, anesthesiologists, anesthesia technicians, cardiac perfusionists, and many others. Allied health professionals contribute to the well being and health of the patient through technical expertise and patient care in line with the standards, guidelines, and ethics of their profession. This chapter explores the role of the surgical technologist, history of the profession, education, professionalism, and professional ethics. A short history of the profession. Surgeons have always needed skilled assistants, including those whose specific roles was created around surgical instrumentation. The role of a surgical technologist has been well documented since the late 19th century. In the late 1800s, she prepared instruments for surgery. In the early 1900s, she assisted in surgical procedures and in the administration in the administration of ether, called ethernizing. Her duties from about the 1920s to the 1940s were similar to those of today's circulating nurse, described later. She also instructed student nurses, often the operating room supervisor. The supervisor was only a graduate nurse in surgery, and it was her duty to oversee the student nurses as they completed their rotation. The need for other student types of surgical assistance became as critical during World War II, during World War One. Army corpsmen Army corpsmen worked on the battlefield to offer aid and comfort to the wounded, but they had no role in surgery. World War II dramatically changed that. The development of antibiotics such as penicillin and sulfa allowed war surgeons to operate and save the lives of many more patients than was previously possible. Technological, technical, technological advantages advantages created a need for more trained professional who could assist the surgeon. The increase in the battlefield survivors created a dramatic shortage of nurses. In addition to the nurses needed to staff the field hospitals, many more were needed at base hospitals. At home, extra nurses were trained to attend to the wounded who returned from battle, to supply the field hospitals in the Pacific and European theaters. The Army began training corpsmen to assist in surgery, a role that previously had been filled only by nurses. By the time, however, corpsmen were expected to administer anesthesia or perform segments of surgery. When nurses were not available, such as on combat ships, corpsmen worked under the direct supervision of the surgeons. The Army referred to these corpsmen as operating room technicians, ORTs. Thereafter, the military played a significant role in defining the role of the ORT. Each branch of the military provided specific training to the ORT. After World War II, the Korean War caused a continued shortage of highly trained nurses. who were needed in many other areas of combat medicine. At this time, operating room supervisors began to recruit former corpsmen to work in civilian surgery. Registered nurses continued to fill the role of instrument nurses until about 1965 when the role changed to circulating or non sterile nurse. At this point, hospitals began training civilian ORTs in the early 1960s. The first steam sterilizer was introduced along with the concept of standards of aseptic technique to prevent post-operative infections. In 1967, prompted by the need for guidelines and standards in the training of um, paramedical surgical personnel, the Association of Operating Room Nurses (AORN) published a training manual called Training Nurses. AORN published a training manual called Teaching the Operating Room Technician. In 1968, the AORN Board of Directors created the Association of Operating Room Technicians, AORT, which led to a formal training for the civilian ORT and pro, proprietary propri, proprietary proprietary schools across the United States, along with organizational independence, came steps towards formalizing the technologist education. The AORT created two new committees: the license clinical Council and Certification for Surgical Technologists (LCCST) and the Joint Review Committee on Education. In 1970, the first certifying examination for ORTs was administered, and those who passed were given the title Certified Operating Room Technician (CORT). In 1973, the AORT became independent from the AORN, and the AORT changed its name to the Association of Surgical Technologists (AST). The certified technician became known as the Certified Surgical Technologist (CST), and that's what I'm going for, my CST. Surgical technologist role. The exact job description of today's surgical technologist varies by the type of surgical facility and the individual surgical technologist (ST's) specialization. An overview of the surgical technologist role in surgery is presented here. Chapter 18 describes the duties and the roles of the surgical ST in greater detail. A formal job description written by the AST and is on the association's website at www.ast.org. Task integration. An important concept for surgical technologist studies, students, and experienced professionals alike is task integration. The ST does not work in isolation. His or her tasks and responsibilities fit into a more complex order involving many other professionals. Healthcare professionals understand that individuals achieve success as part of a team. Becoming a team player is extremely important in modern complex medical surgical care. Scrub role. As a member of the sterile team, the ST performs hand and arm antisepsis, dons sterile gown and gloves, and is an active participant in surgery. In very simple terms, the sterile team, which includes the surgeon and assistants, delivers direct surgical care by performing the surgery. The ST supports the surgeons and assistant surgeons' work. In this position, the ST is often referred to as the scrub. The scrub also assists the surgeon in specific, well-defined tasks as needed during the procedure. The term scrub has been used to describe this role for many years and predates the current title surgical technologist. Even though the role has evolved, the name remains as part of a tradition. The scrub role can be fulfilled by various professionals, including registered nurses, licensed vocational nurses, and licensed practical nurses (LPNs). The ST surgical scrub role, scrubs ST or simply ST in the next term, scrub is used interchangeably with scrubbed ST. Surgical procedures require many different instruments, supplies, and equipment specific to the type of the surgery being performed. These range from a relatively small number of basic instruments to very large instruments sets of specifically instruments for a specific body system, such as orthopedics or ear, nose, and throat (ENT) surgery. Complex operations require hundreds of items to be immediately available for surgeons' use. Some instruments require a simple assembly on the field, the immediate sterile work area of the team. Sutures must be prepared, and supplies such as sponges, medications, solutions, and electronic devices must be carefully handed to the surgeon throughout the procedure. These are persistent as needed at the precise moment they will be used. This is accomplished by learning each step of a particular surgery and a specific preferences of the surgeon. The scrub protects the sterile field from contamination and communicates effectively with the surgeon to prevent errors such as passing the wrong instruments or passing it in the wrong orientation. Ears consume valuable time and causes disruptions that are distracting to the surgeon and are not conductive to safe surgery. This means that the scrub must always keep this instrument tables neat and orderly. The scrub communicates with the circulator to receive other items needed during one person here during a surgical procedure. The knowledge and the skills required to be a surgical technologist are learned step by step through study and practical experience in surgery. All of which I have, just so you know. Assistant circulator. A surgical technologist in the circulator role is identified as an assistant circulator, ST circulator, or STCR, surgical technologist circulating role. A registered nurse is required to be immediately available, present in surgical cases. He or she is the primary circulator. In this text, the term ST circulator refers to the assistant circulator position. Whereas the scrub is a sterile team member who remains at the sterile field throughout the surgery, the circulator is a non-sterile team member who is responsible for many different tasks, including direct patient care. Traditionally, this role was fulfilled exclusively by a registered preoperative nurse. In the past decade, the surgical technologist role has expanded to include some of the circulator's responsibilities. The exact duties vary somewhat by state, region, and health facility. The circulator role is quite different from that of the scrub. The circulator does not directly touch any sterile instruments, supplies, or equipment. Instead, he or she obtains, delivers, and prepares the non-sterile equipment. The circulator also distributes and opens sterile instruments and other supplies for the sterile team members using a method that protects the sterile items from contamination. The circulator also responsible for positioning the patient before surgery, assisting the anesthesia care provider, and receiving tissue and other types of specimens from the sterile field, and preparing them correctly for the pathologist. He or she ensures that the patient chart includes results of diagnostic procedures, permits, and preoperative like checklists is available at the time of surgery and makes preparations for the next surgery on the schedule. Other duties of the circulator include performing the surgical skin prep and the urinary catheterization. The circulator is the main communicator between the surgical team and the personnel outside of the operating room, and it is also responsibility for case documentation and many other tasks. The role is described fully in later chapters. The AST web also provides the basic description of the ST assistant circulator role, which can be adapted to state and regional practice. This is too much. Like, who? Look how thick this book is, bro. And I gotta take this exam. Oh man, am I lazy? Fuck. This is so aggravating because I took this test already and I didn't pass. I got a 93. Oh, I guess it's whatever. I need to get past this stuff. I'm not even past this. I got like, oh my god. Most surgical procedures require second assistant. Most surgical procedures require one or more assistants to the surgeon. The first assist may incise or remove tissue, insert scissors, clamps, blah 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 blah. See, this is what I'm saying. Like, this is why I feel like communication and team, blah blah blah. Man, fuck. Look at all this shit. And the crazy thing is, I read this. I just don't remember. Decontamination, sterilization, and disinfection. Okay, this is important. After reading this chapter, the reader will be able to correctly use terms related to disinfection and sterilization. Explains the scalpel system of classification. Describe the steps of reprocessing surgical instruments from the point of use to sterilization. Discuss the principles and the processes of decontamination. Explain the rationale for specific methods of wrapping of instruments and loading of the steam sterilizer. Explain the principles of gas sterilization. Describe special processing required for instruments exposed to the disease. Yeah. Distinguish between disinfection and sterilization. Recognize the hazards associated with the use of chemical disinfectants. Describe terminal cleansing of the operating room environment. If I didn't do this now, I wasn't gonna do it. This, you know what it is, yo? It sucks. It sucks. It sucks because it's like, fuck. Like, you really gotta know this stuff. And you gotta take a test to prove that you know it. There you go. Why is the phone doing this? I hate my man. This shit is so stupid. Yes, hi Beth. My name is Desiree Thompson, and I'm calling regarding my membership online. Um, no, I have my card I just got in the mail. With that, oh, let me pull it out my wallet. These wallets are not easy to get out sometimes. Let's see if I can get this out. I'm so sorry, ma'am. I didn't mean to not be prepared. Oh, I know. Okay, let's see. Why is this not coming out? I'm sorry. Give me 1 second.